Hi everyone, and welcome back to another episode of our radiography review series. Today we are covering an often underappreciated topic, ergonomics and monitoring. We've already talked a lot in previous episodes about patient care and communication, but here we're going to focus specifically on two things. First, how to protect yourself physically through proper ergonomics and safe patient handling. And secondly, how to monitor and assist your patients with their medical equipment, recognize changes in their condition, and prevent falls. So let's get started. Section 1. Why ergonomics and monitoring matter. In the last episode, we introduced several of these key points, but it will not do any harm to review and go over some of them again. As a technologist, your job isn't just about operating equipment, it's about keeping patients safe while also protecting yourself from injury. We lift, transfer, adjust, and reposition patients all day long, and if we don't do it properly, we can hurt ourselves and our patients. And at the same time, many of our patients come to us with serious conditions or fragile health, so it is our responsibility to monitor them closely and assist with their medical devices. So let's start with ergonomics. Section 2. Principles of body mechanics. Good body mechanics help you avoid injury while moving patients. Remember these principles: balance, keep your center of gravity over your base of support, stand with your feet apart and knees slightly bent. Alignment, keep your back straight and avoid twisting, move your feet to turn. And movement, use your legs to lift, not your back, and keep the patient or object close to your body. Practicing these consistently can save your back and shoulders for years to come. Section 3. Patient transfer techniques and devices. Before you transfer a patient, assess: can the patient help themselves? Are they steady enough to stand or pivot? Do they need help from a co-worker? Or are devices available? If they can help, you might just need to guide them using a gait belt for stability. If they can't help at all, using assistive devices like a transfer board for sliding or a Hoyer lift for completely dependent patients. Other tools, such as sponges and straps, can help maintain positions once the patient is on the table. Section 4. Assisting patients with medical equipment. Now let's talk about something just as important: how to handle patients who already have medical equipment in place. These patients are often in critical or vulnerable condition, and mishandling their equipment can cause serious harm. Infusion catheters and pumps. Many patients will have IV lines or infusion pumps, so always check that the lines are not kinked, pinched, or pulled during a transfer. Make sure the pump remains on the correct setting. Do not adjust it unless you're trained and authorized to do so. Always checking the lines when you fix the handrails. Many times these can get caught, so it's always worthwhile making sure that none of the lines are pinched when you're readjusting handrail. Oxygen delivery systems. Patients may come with nasal cannulas, masks, or even ventilators. Make sure the oxygen supply stays connected and the flow rate stays the same where it is set. Oftentimes this information can be found on the chart. Do not remove or adjust oxygen without consulting a nurse or a physician. Some other devices to consider are nasogastric tubes. Be careful not to pull or kink on them. Urinary catheters. Keep the collection bag below the bladder level and do not let the tubing become dislodged. Tracheostomy tubes. Do not block or cover the opening and avoid pulling on the tube. If you are ever unsure about a device, ask for help from the nurse. Never guess. Section 5. Patient monitoring and documentation. While you're working with a patient, you're also responsible for monitoring their condition. Let's talk about vital signs. Vital signs are the most immediate and objective indicator of a patient's physiological status. The 4 classic vital signs, which you should be able to measure, interpret within normal range, and recognize as abnormal are temperature. Normal oral temperature is approximately 98.6 degrees Fahrenheit, with a general acceptable range between 97.7 and 99.5. Hypothermia, fever, called pyrexia, and hyperpyrexia can signal infection, sepsis, or other pathology. Pulse rate, also known as the heart rate. The normal resting adult pulse is between 60 and 100 beats per minute. Tachycardia is a heart rate greater than 100 bpm, and this can result from anxiety, hypovolemia, or cardiac compromise. Bradycardia is a heart rate below 60 beats per minute. This may indicate a vagal response, cardiac conduction issues, or athletic conditioning. Assess not only rate but also rhythm, i.e. regular versus irregular, and the strength. Respiratory rate. Normal adult respiratory resting rate is 12 to 20 breaths per minute. Tachypnea would be greater than 20 breaths per minute, and this can indicate respiratory distress, acidosis, or anxiety. Bradypnea is less than 12 breaths per minute, and this may suggest sedation, neurologic injury, or respiratory depression. Note the effort of breathing. Use accessory muscles or signs of dyspnea. Blood pressure. Normal systolic pressure is less than 120 milligrams of mercury. Diastolic is below 80 milligrams of mercury. Hypertension would be seen at greater than 140/90, and this can put the patient at risk for stroke or cardiac events. Hypotension would be indicated with 90/60 and lower. This may signal shock, blood loss, or dehydration. If possible, note whether the patient is symptomatic. Are they dizzy or experiencing syncope? Be prepared to quickly report significant deviations to the attending nurse or physician, and document clearly in the patient record when required. Next, we look at physical signs and symptoms. Beyond vital signs, you're also expected to observe and assess clinical signs and symptoms that may indicate a change in the patient's status. Here are some key categories to be mindful of: neurological status, altered level of consciousness, from alert and oriented to lethargic, stuporious, or unresponsive, changes in speech, confusion, or the inability to follow commands. These are potential signs of stroke or worsening head injury. Pupillary response. Unequal pupils or sluggish reaction can indicate increased intracranial pressure. Motor control and sensory function. New weakness, paralysis, or numbness in a limb. Involuntary movements or tremors, and loss of coordination or gait instability. Signs of injury or distress. Worsening pain, bleeding, swelling, or bruising at an injury site. Skin color changes, pallor, cyanosis, jaundice, or mottling. Diaphoresis, also known as sweating. Clammy skin or cool extremities, which can indicate shock or hypoglycemia. Respiratory and cardiovascular distress would be an audible wheezing, stridor, or gasping. Chest pain, palpitations, or complaints of impending doom, which could suggest myocardial infarction or pulmonary embolism. Fall prevention. As part of monitoring, you can also play a critical role in fall prevention, especially since your patients may be sedated, weakened, or disoriented. Always keep the bed or stretcher side rails up when not actively transferring the patient. Ensure the patient's feet are properly supported when standing, and assess for orthostatic hypotension. This would be dizziness upon standing. Remove tripping hazards in the room and use gait belts for unsteady patients. Stay within arm's reach during transfers or ambulation. Falls are among the most common reportable adverse events in healthcare, so vigilance here protects your patient's safety and your team's liability. Professional documentation. Everything you observe, measure, and respond to should be documented in a factual, objective way. Record vital signs at the appropriate intervals and note if they are within normal limits or abnormal. If a change occurred during your exam, note the time, what you observed, and what actions you took. For example, notified the RN at 13:40, patient repositioned, oxygen applied per order. Avoid subjective language or assigning diagnosis. Describe what you see. Good documentation protects the patient, ensures continuity of care, and protects you professionally. If a fall does happen, don't try to catch the patient by pulling, guide them gently to the floor if possible, and then call for help and document the incident thoroughly. Section 6. So why does this matter? Why do I emphasize all of this? Because as a technologist, you're the one physically handling patients in many of their most vulnerable moments. If you don't use proper technique or pay attention to their equipment and condition, you could cause harm and even face legal or professional consequences. But if you take your time, stay aware, and use the right tools, you can keep both yourself and your patient safe. So that wraps up our review of ergonomics and monitoring. Let's recap the key points. Use proper body mechanics and assistive devices to protect yourself and your patient. Be aware of medical equipment like IVs, oxygen, catheters, and tracheostomies, and handle them with care. Monitor the patient's vital signs, physical condition, and fall risk, and document everything clearly. Thanks for listening. Keep practicing these skills every day so they become second nature. And as always, keep studying, keep caring, and keep growing into the kind of technologist your patients can trust. See you in the next episode.